So Shanghai in December, schools closed due to excessive air pollution. So what is the impact of air pollution on breathing? We've seen the very visual elements of smog in Beijing, and also the sort of the density of air pollution matter. And actually for children and their parents who have been living with air pollution over the last 10 years, what is the impact on their breathing apparatus and how they breathe? So Uhoo provides intelligence to people with respiratory conditions to assist them in better managing their health. The platform comprises two devices. So there's one wearable health device that monitors the breathing rate and the blood oxygen levels. And then there's a second device that monitors air quality. So it breaks down this cocktail of air that we're currently breathing in. Then the data gets sent to the cloud. We're also able to collect some regional open data on air pollution. And then the analytics come back with notification and recommendations to the user. And the user is also able to track the long-term history. So the user interface, to go through it briefly, so there's a user, the Uhoo index provides an overall sort of representation of the current health and pollution status. Then there'll be another indicator of overall pollution, another indicator for health, and then we'll be able to provide history and then actions and recommendations to the user. In terms of the actual devices, so the real key thing is to be able to do long-term continuous monitoring. And to be able to do that, it needs to be non-invasive. So the wearable device will be able to monitor your blood oxygen levels for a pulse oximeter. We'll be able to monitor it continuously. And then the indoor air quality device will be able to monitor air pollution through a dust particulate matter sensor and volatile organic compounds through a VOC sensor. So in terms of the target market, there are some sensors, devices that look uniquely at air quality and uniquely at health. We've looked at the customer market and segmented them into people that actually are concerned about air quality and also have respiratory conditions. So bringing the two together, we look at the overall target market as really bringing together health and air pollution. And looking at sort of four major cities in China, with a population of 60 million, there's about 20 million people who are either in a sensitive group, such as a young or an older generation, or have a respiratory condition, such as asthma. In terms of the management team, so there's Dustin, business partner, will be joining for the Q&A. He's got a healthcare consultancy background, and he's been developing partnerships, speaking to Abbott and other air purifier manufacturers. Myself, I'm a sustainability consultant, having worked in architecture and looking at the relationship between air quality and health. Brian and Yoshi, who are in the crowd today, Brian is an engineer, he's looking at the software architecture, and Yoshi used to work at Yamaha as an industrial designer. We've got two great advisors, Michelle, who's advising on the medical side, the links between for the health device, and then Michael Sung, who is working who is an entrepreneur and also has a PhD in biomedical sensing. We're really happy to be here at CoCoon. It's great to be able to connect with people. We're really interested in sensors, air pollution, Internet of Things, so happy to connect on that side. We're currently developing the first prototype, so we're able to do the outline architecture, but we're actually looking for a software developer who is interested in air pollution and able to develop the gap between the cloud analytics and the software. In terms of our status, so we're currently building the first prototype. We're looking for angel investment to be able to deliver our product. So to summarize, Uhoo provides is an health intelligence platform that provides recommendations to people and help them better assist their health. And we know that people have been living with air pollution over the last 10 years. We want to help the people who are going to be living in air pollution over the next 25 years better manage their health.